What's the difference between Ibogaine and ketamine? Okay, they honestly could not be more different. Ketamine is essentially a horse tranquilizer, and it's used to treat anxiety and depression, mostly anxiety though. And I did do ketamine therapy, and I could go make a video about that if you guys want. When I was under the influence of ketamine, I would describe it as like a floaty, spacey type of feeling. Ibogaine is a psychedelic, a hallucinogen, and from what I've read, it could be pretty intense. And of course, I'll do a video about my experience being under the influence of Ibogaine once I have done that. I did do mushrooms when I was younger, but other than that, I've never been under the influence of a psychedelic, so I'm a little bit nervous. But the main difference is that Ibogaine is used to help with withdrawal symptoms. Ketamine, unfortunately, does not do that. It does target pain receptors, so when I was doing ketamine therapy, I was definitely taking less of my medicine. Ibogaine really, really helps with your withdrawal symptoms, which is why people remain addicted, because going through withdrawals is very hard. I could go into detail about why I believe it is illegal in the US. We could talk about the billion-dollar pharmaceutical industry and why doctors get paid to keep us on these addictive medications, but that's just my personal opinion. It is legal in Mexico, where I'm going, as well as Canada and a bunch of other places. I will say that ketamine therapy was very successful for me. Before I went to ketamine therapy, it's actually been a year this past week that I finished ketamine therapy. Before I went, I was having panic attacks weekly, and I mean full-blown panic attacks. I have not had a true full-blown panic attack since, but the last 2 weeks, I definitely feel my anxiety kind of like creeping back in. So I'm really curious to see what Ibogaine does for my mental health. It is very successful for treating anxiety, depression, and other mental illnesses. And I do suffer from depression. I did finish TMS therapy a year ago as well, and that really did minimize my depression. Ketamine therapy, I believe you're supposed to kind of like redo every once in a while to help with your anxiety. And Ibogaine is kind of like a one and done, I would say. Like you get your flood dose, and that's where you get a lot of Ibogaine at one time, and it can be intense, so I've heard. And then you get like smaller boosters throughout your stay. But I'll only be getting administered Ibogaine, I think like 2 or 3 days while I'm there, compared to ketamine therapy. I was having to take ketamine 3 to 4 times a week for 2 months. But I just got my official date. I will be traveling to Beyond, the facility I'm going to, November 6th. And if you guys have any more questions, please ask away, because I love answering them.